Look, the first thing I'd say to you is I know a lot of people are champing at the bit. I've had a lot of patients come in this morning actually asking me about when they're going to get the vaccine. Look, this is not like the flu shots. We've got all the 16, 20 million shots ready to go. A lot of the vaccines still have to be delivered, and they have to be get out to the practices. So it's going to be a staggered start, and it's going to build up. And as you've indicated, it's going to go through these phases where it's a huge logistical exercise to get the vaccines to each individual. Now, what will happen is that it's very likely that as each stage comes up, when there'll be general information out in the community, so general alert through normal sources and media about this group is ready to go. Please get ready to get your shots. And then there will be information, ideally through a particular website. I gather it's Health Direct, and the details will still be determined. But essentially, you'll be able to find out the details about whether you fit into a particular criteria, get information about the vaccine, and then find out where you'll be able to get it. So that's the most likely mechanism by how it will happen. Now, there will be other means, word of mouth, even within practice, for example, they'll be able to send out information if you're sitting in a particular cohort. So we'll have data here that you're in a particular group and send out information. So there'll be various sources, media, through a particular website, probably through practices as well. So I think people will know when it's time.
Right, and I guess most people will, but does that mean in terms of where you sit within the cohort is a bit of an unknown? It might be state by state. So, if I'm in the last official cohort and that cohort comes up, well, there are 6.7 million people or something in that. At that point, I just try to book somewhere, do I? And it's a bit of a case of, well, if the more eager people get in earlier?
And in some ways that will be the case because, within that group, they're all going to be deemed as equal. So it's a matter of people just getting, organised to be able to find a convenient time to have the injections. And that's really important because it's a matter of finding a time that's convenient to you, because we need people to turn up because we don't want wastage of the vaccine, and we need to coordinate this as well as possible. So it's two sides. We've got to do it up our side correctly, but we need people to be able to get there at the right time.
All right, and just interested as well, 80,000 this week, but when this rolls out at full speed, 800,000 give or take per week. It might even be more than that are needed according to different estimates. Will that be a real strain on the health service? Will it be difficult to get doctors' appointments perhaps as this is rolling out?
This is a huge exercise, and I think I've said to you before, this is the biggest, logistical exercise in health that we've ever seen. And so it will be a matter of all hands on deck, and it will be a matter of practices, stepping up when it's their turn to join the fight. But there will be other mechanisms to get it. Certainly all the hospitals will be online. There'll be other health services online. And I think it is likely we'll be looking at other mechanisms as well to get it out there as quickly as possible, because it is a huge exercise. And what we ask people is to be patient in the initial stages, understand that today's the start date and it's going to build up, but to be patient, but also to make sure that when you do make an appointment, to turn up when it's your turn.
Interested as well when you talk about people taking the jab and needing to turn up. What about the compulsory elements of the government not deciding to make this compulsory, for example, for aged care workers? The flu shot is in some medical environments. What did you make of that decision?
Look, I actually, there has been a bit of debate about that. I do understand the scientific basis in that the evidence at the moment is that there is no clear evidence that the vaccines do stop transmission. So the main thing, again, is the vaccines stop you getting sick and severely sick and dying. And that's quite a good first aim. The evidence for them stopping transmission is less. So therefore, the evidence to, make it compulsory for workers in aged care was less so. Having said that, that may change even in the next few weeks or months as we get more information about it, because then if we do find that the vaccines do stop you catching it when you don't realise it and then passing it on, then in fact you may pose a risk if you don't have the vaccine. So that may change, and the guidance may change, and this may be in many walks of life. So at the moment it's not mandatory across the board, but it may be that it'll become mandatory if you want to engage in certain work.